What I want to focus on in my brief time is the Republican alternatives that we've had all along. When the Affordable Care Act was brought to the floor, there was only one amendment allowed, and that was a motion to recommit amendment. And guess what? The Republicans had an alternative health care plan, which we put forth. Since that time, we've had multiple plans, almost 200 other proposals from Republicans to reform the health care system in a patient-centered way. And as a physician, that's what we want. We want this to be focused around the patient, not around Washington bureaucrats, not around decisions made here in Washington. But we want patients to have access to quality, affordable care, and we want everyone to have that, just like the Democrats say that they do. Even though with their plan, the Affordable Care Act in 2023, the CBO says 31 million people will still be uninsured, which is a fact that not a lot of people are looking at in the media at this point. But we've had all kinds of alternatives. Dr. Tom Price has had a bill that he's put up many times, H.R. 2300 in this Congress. The Republican Study Committee in this Congress, led by Dr. Rowe, has a very good health care reform proposal. And again, along with almost 200 other proposals to reform health care. So I want to dispel this myth that Republicans don't have alternatives to a near government takeover of the health care system. As Congressman Elmers just stated, that's the plan here. The plan is to have the government nearly control the system, and we can't have the government in health care because it doesn't work. And we're finding that out now with what's happening with the Affordable Care Act. Access is actually going to be inhibited by the Affordable Care Act. In some states, 80–90% of the people signing up for the Affordable Care Act are in the Medicaid program, a program already underfunded, a program already that's poor insurance that limits the very access to health care that we're all fighting for. The exchanges, which are going to be overly costly. Look at the deductibles you're seeing in some plans across the country. Look at the price you're seeing on the monthly payments across the country. Again, over 5 million people had health care that they liked, but they've lost it. We may see 50 million people or so next year when the delayed employer mandate comes into place that was unilaterally delayed by the administration, I would argue against the will of Congress because it was in the law and is in the law. So I want to just focus on the fact that Republicans have alternatives. The GOP Doctors Caucus has been involved in all of these. And I don't recall, but you probably can tell me, where you consulted in 2009, the doctors in Congress, when the health care law was passed? And from what everybody tells me, no. The answer to that question is no. If you were going to talk to anyone about what might be good health care reform, wouldn't you think you would actually consult with people that have been in the field practicing medicine for years? The doctors, the nurses, the other health care providers in Congress that could give you that firsthand experience that they've had in the health care system as part of the equation if you're going to do this right. So again, Republicans are for patient-centered health care reform. We realize that people were uninsured. We realize that the cost is too high. We want to bend the cost curve, get people insured by getting the cost of health care down and making sure that all of our patients have access to quality, affordable health care in a timely manner without Washington, D.C. government bureaucrats telling them what is a good policy, what's a bad policy, and I will argue in the future telling them what's good health care and what isn't.